Okay, so this slide's a little bit of an overlap with the next chapter we're going to work on, which is going to be about the skeletal system. We're going to kind of jump ahead a little bit and give you a term we're going to use, lumbo, which means loin or lower back. And that makes the word lumbar when we put our R, our pertaining to suffix on the end of it. So lumbar means pertaining to the loin or the lower back. And for any of you who are interested in doing radiology, one of the things you will learn how to do is do a shot of a lumbar spine, both in AP, so from front to back, and laterals. You're going to do a lot of lumbar spines, as a matter of fact. It's one of our main orthopedic pathologies that we see out in the general medicine. Lumbar spine gets a lot of strain, a lot of misuse. People go to PT to learn how to use their back so that they don't cause any further problems. And a lot of our actions, just the way we carry ourselves and move our body, can cause strain to the lower back. And so it's a big source of pathology in orthopedics. We talk a lot about lumbar spines, and we see a lot of surgical procedures performed on lumbar spines. And it's something, God forbid you ever need that. So take really good care of your lower back, and you may not need to even go there. Musculo means muscle, as in muscular, pertaining to muscle. So that's, again, there's our AR pertaining to suffix to attach to musculo, and we have muscular, and you're familiar with that term, I'm very sure. Myo, however, is a new combining form for muscle. We did talk about this a little bit back in the cardiac chapter when we talked about the myocardium. So myo, meaning muscle, gives us the words, for example, myopathy, which is a muscle disease. Myalgia is a way of describing muscle pain. So we talked before about sprains and strains. A strain would be a form of myalgia. We also have myoplasty. This is a surgical repair of a muscle. So anything you can think of that might be defective in a muscle that could cause surgery, this type of procedure would apply to it. And of course, part of myoplasty would be performing a myotomy, which would be incision of a muscle. So once again, it's such a broad subject and the different things that could be done. There's one here that's shown where they have a defect. One muscle is shorter than the other in this gentleman's face in the before picture. And they have somehow worked with the muscles. They performed some surgery in order to balance that out so that the mouth is no longer pulled off to the left-hand side of the face, but rather centered. So that's an example. That would probably fall more under plastic surgery, but once again, we have to remember plastic surgery is not necessarily frivolous surgery. It's just maybe not life-saving. However, in some cases it may be. So, keep that opinion very broad and open. Also, some other words that tie into myo would be myosclerosis. This is a hardening of a muscle. So, we've talked about the breakdown of the body over time, and this is part of the process. Myorexis may be what results from the hardening of a muscle. It would be the rupture or tear of a muscle. But of course, that can happen without myosclerosis being present. Could be just a very severe strain, could rupture a muscle. And myopathy is the suturing of a muscle. So we're going to put it all back together. We're going to suture it. In other words, we're going to put some stitches in it to kind of hold it back together and try to repair it. And another myo word here, it's a less happy word, more of a threatening word, myosarcoma. So sarcoma is a suffix that means malignant tumor of connective tissue. And so muscle, bone, tendon, ligament, cartilage, and arguably skin, if you want. These are all forms of connective tissue. And they have tumors that are specific to that type of tissue. Myosarcoma is one of them. And remember the term malignant, we went over it a few times already. Malignancy is something that's going to cause death eventually, or it's going to cause some very serious conditions. So myosarcoma is a malignant tumor of muscle tissue. And you can only hope that those types of tumors are found early in, so they can be surgically removed. And it is possible to have a myosarcoma removed and it never be a threat to your life. However, it is something to consider when you're talking about the surgical procedures and when they're looking through to see what might be causing pain in a certain area. Sometimes they find that it is a tumor. And it's not one of the happier words. I lost a good friend to a myosarcoma, so I'm not a big fan of them, as you can well imagine. There's the word. Now you know what they are. We can also go into a term called myasthenia. And this is using myo for muscle. And asthenia, of course, means weakness, right? So a really common disorder is myasthenia, which you're seeing here in the facial muscles around the eyes. And you can see in the top one especially, one eyelid is further open than the other, and that's the result of myasthenia. So there's a muscle weakness going on there. And there's all sorts of treatments for that. Sometimes it's surgical and sometimes it's not. Just depends on what they're looking at and what they're trying to fix. If they want to look at electrical conduction of a muscle, and just like when we talked about the heart, there's a lot of electrical conduction that happens in all of our muscles. That's why we need electrolytes, minerals, in other words, potassium and salts for the most part. If we want to measure that activity, we use an EMG. Now, it's sort of similar to an EKG, but that EKG works simply on the heart. Remember, the K or the C stands for cardio in ECG. And EMG is electromyography. Same sort of concept, really. This is an electrical recording of muscle activity, and it aids in the diagnosis of neuromuscular disease. So it's performed in a similar way to an EKG, similar enough that you can make relative comparisons on it, but it is measuring the muscle activity of a different type of muscle other than cardiac. It's skeletal muscle that we're measuring. Now, for those of you interested in physical therapy, working in orthopedics, rad tech, those types of things, you're going to be moving people around. There's some terms you want to know. We covered these at the beginning of the chapter, or beginning of the semester rather, in chapter 2. We're going to review them. Flexion is bending a limb. Extension is extending a limb. So there's the prime example in these two diagrams here. Abduction is moving away from the body. Remember, not a happy thought, but it's a way to remember it. Children are sometimes abducted, or people are abducted and taken away from you. And adduction is moving towards the body. And I like to look at that word and I see add, ADD, thinking I'm adding to the mass of my body. It's moving towards my body, adding to the mass of my body. So abduction, adduction. Rotation is circular movement around an axis. Pronation is turning the palm face down. Supination, turning the palm face up. I think I mentioned to you in chapter 2 that if you're going to carry a bowl of soup, as in supination, you're going to turn the hand up and let the bowl sit in the hand. If you were to pronate that bowl, you're going to dump that soup on the floor. So pronation, turning palm face down. Supination, turning the palm face up. These correlate directly to the terms supine and prone. When we use supine and prone, we're talking about the entire body. And when we talk about pronation and supination, primarily talking about the hands and the upper extremities, the arms, in other words. Dorsiflexion and plantar flexion, these are specifically talking about the feet. Remember the top aspect of the foot, some will call it the anterior foot, but it's the dorsal aspect of the foot. And the plantar aspect of the foot is the surface on the bottom. The plantar surface connects you to the planet. Pardon me. I just stumbled over that. Let me try that again. The plantar surface connects us to the planet. So the idea is the bottom of the foot is the plantar surface. The dorsal aspect is the top of the foot. Dorsiflexion is bending the foot upward in the dorsal direction, and plantar flexion is bending the foot downward or away from the body. Sorry, I stumbled over those words. Also, very specifically to the feet, we have eversion and inversion. Eversion is moving to the sole of the foot outward. Inversion, as in moving it inward. Inversion is moving to the sole of the foot inward. So if you intend on doing this, it's a great thing. If you're doing PT, they may work on eversion and inversion, especially if they're working on an ankle issue. If you do this accidentally, it can end up in a very severe sprain of the ligaments in the ankle. Here's sort of a diagram of some more movements, and we show these because an important abbreviation, especially when we're talking about orthopedics, is ROM, range of motion. So it's abbreviated ROM, and it means range of motion. And this is the measurement of movement around a joint. So basically, if there's a joint injury, in a primary assessment, we're going to look at the ROM. We want to know what the range of motion is. Most joint injuries, the ROM is going to be slight because there's inflammation present, and that limits the amount of movement a joint can participate in. So it doesn't always necessarily mean it's severe. As we track the progress of this pathology, of this injury, we keep measuring ROM. We want it to improve as therapy continues, and sometimes it does, and if it doesn't, something else is going on. And our very last word for this particular chapter is going to be ambulate. It means to walk or move about. And I'm pretty sure we've covered that before, but in case we haven't, there it is now. They will often talk about a patient's ambulatory status. We do it all the time in orthopedics and quite often as rad techs. They call down and say they're bringing a patient, and if we're in the hospital, we'll say, well, what's the ambulatory status? Because they may be asking us to get a certain x-ray the patient has to stand for, but they might bring us a patient in a wheelchair who can't stand. So we have to ask those kind of questions. So ambulate is the general word. Ambulatory status is a way that nurses, doctors, and RTs, physical therapists, that's the way we assess how someone is moving. Also medical assistants would use that term. All right, we're going to stop it there. That's the end of our first slide presentation for this chapter. I'm going to come back with you in just a few moments and have some great information about the skeleton for you.